Great. Thank you very much, Julie. I'm very happy to be here on behalf of the Sleep Research Society to join you in this important Sleep Advocacy Forum. My apologies, Patrick Fuller wasn't able to join us. He's the chair of our advocacy committee, or our advocacy task force, and he is actually flying over the country right as we speak. So I will do this with no further ado here. The Sleep Research Society is a member organization. We have about 1,300 members nationally. We have international representation as well. And we are all part of this professional society with the common shared belief that sleep is the pillar of health. It's essential for sustaining life and restores mind and body. And I like this quote from Shakespeare's Macbeth: sleep is a chief nourisher in life's feast. The mission of the Sleep Research Society is to advance sleep and circadian science, and its purpose is through its members and leadership. It is dedicated to communicating scientific, educational, and engaging in charitable purposes. And we foster scientific investigation of sleep and circadian biology and work together to help foster the next generation of sleep and circadian researchers and educators. Our goals are to provide forums for exchange of information pertaining to sleep research, scientific publications and meetings, to establish and maintain standards of reporting and classifying data in the field of sleep research, and to collaborate with other organizations, national and international, to foster scientific investigation on sleep and its disorders, and to educate professionals and lay people on sleep and circadian biology and its impact on health. So partnership and participation in the last several months, you heard from Dr. Koroshetz. We engaged in symposium planning and participated. Our president currently of the Sleep Research Society is Dr. Craig Heller from Stanford University, and in collaboration with Vicki Whitmore of NINDS, put together this blueprint activity beyond the symptom, the biology of fatigue. This was a workshop that was held September 27th and 28th in collaboration with the Sleep Research Society. And we will actually be putting out a white paper. So you can actually go and visit and see those talks, but you can also watch for the white paper in addition, which will hopefully bring forward some important gaps and opportunities for the field. In addition, we partnered, our members participated in a workshop identifying research directions in sleep, circadian biology, and COVID-19. And this involved the heart, lung, and blood, Mariska Brown and Dr. Koroshetz mentioned, also the National Institutes on Alcohol Abuse and Alcoholism, National Institute on Minority Health and Health Disparities, and National Cancer Institute, and Office of Behavioral and Social Sciences, NINDS. In addition, we this past year partnered with the American Academy of Sleep Medicine. The CDC put out a call for proposals for education opportunities and on expanding the national approach to chronic disease education and awareness. And we partnered with the American Academy, the Sleep Research Society. Melissa Clark is the AASM principal investigator, and the program is going to be called Patient Obstructive Sleep Apnea Awareness Project. And that is going to be a new program just currently under development. So the Sleep Research Society, the strategic map for 2018 to 2022 is indicated here. And you can see, strengthen membership recruitment, engagement, and retention, maximizing the impact of advocacy and outreach, enhancing vibrancy and breadth of scientific offerings, strengthen the quality of career development programs and services, and to increase and sustain resources to achieve these goals. And these are part of our purpose to build a robust, diverse, engaged sleep and circadian research community. And this advocacy and outreach work is what the Advocacy Task Force is concerned with particularly. And we have been very active this year together with our members and with our partnerships. We have been pursuing the legislative agenda and have heard recently responses by the House. The House is calling for $3.5 billion in additional funding for the NIH, along with another $3 billion for ARPA-H, and also the Veterans Administration Medical and Prosthetic Research Program has had an 87 million increase request put forward, and the CDC Chronic Disease Education and Awareness Program, 3.5 million increase has been requested. And the Senate and Department of Defense bills are not yet released. The Senate bill funds the PRP rather, and includes sleep disorders in its annual eligible contributions list. So sleep is well represented in the requests for funding. Here you can see the Advocacy Task Force members of the Sleep Research Society on top, Patrick Fuller being the chair, and I serve as the vice chair. We have members from across the country representing a wide range of states and scientific expertise. Scott Williams from the Academy serves as our liaison to the American Academy of Sleep Medicine, and our SRS board liaison, Namni Goel, staff John Noel and Dale Dirks and Dane Christensen are part of the Health and Medicine Council of Washington, and Julie Flygar, Project Sleep. All are active members of our advocacy task force and engaged in a number of efforts to increase awareness about the importance of sleep and funding for sleep research. And I think that is what I have to share with you today. Thank you very much for your attention. I'm sorry about the technical difficulties.
Thank you so much, Dr. Mullington, and thank you to SRS for your incredible leadership in advancing sleep research advocacy. It's been incredible to be working with the SRS over the last couple of years, and really glad that we're seeing so much great sleep research funding continue to grow across the different institutes at NIH.